Zach, brother, appreciate you coming on today, man. How you doing?
Life's good, Adam. Life's good. It's been a long time, and it's really good seeing you. I'll take 2D, even, I'd rather 3D, but I'll take 2D.
Well, you're not too far away from Scott, so you're down in Vegas. So hopefully our paths will cross sooner than they have in the past. But until then, let's catch up, man. Talk all things movement and the future of PT because I think there's some exciting things we were both just chatting about, and we can really dive deep in here. But before we do that, many people are familiar with who you are and the continuing education course, the matrix that you put out there, but also not everyone knows who you are. So briefly, could you touch upon kind of your journey to how you got to where you are within the movement and physical therapy space?
Yeah. So it all started, been a physical therapist now this is year 13, almost coming up on year 14, which is crazy to think about. Before PT, I was in the track and field, 800, 1500. Those were my events in college. Fell in love with the training aspect, not so much the distance running aspect. So I moved to that. And one thing about me is when I get into something, I really get in. I get very obsessed about it. And so trying to consume as much as I can to try to do good work at this thing. And that's where I came across our mutual mentor friend and more, Bill Hartman. And I sent a random email to something that he never checked because I wasn't sure how to get a hold of him. Saying, hey, man, can I learn from you and do one of my clinical affiliations? It was like 2 or 3 months later, and he replied back. He's like, yeah, sure. Okay, cool. Had no idea what I was getting into, but he just changed everything for me, because it was like at the time, and I mean, to this day, I looked up to what he was doing, and not just clinically, but then also outside with education, writing, among other things. And I'm like, man, yeah, I want to do this, what he's doing. And so he really, started me on the path that I am, and I'm grateful for him for that. And so then, over the last 13 years, I've worked in a lot of different domains. Worked in hospital setting, both acute and outpatient, then private practice. I did physician owned, which is always risque. I was training people a lot on the side with throughout that. And then I, much like you, had a position in the NBA with the Memphis Grizzlies for about a year and a half. And then as that goes in there, I got fired. And that was probably one of the best things that ever happened to me because I think some of the ego that I built up along the way got notched down. And it was the moment that it took me to look back on myself and say, I'm the problem. I need to fix this. And I think it really started the trajectory that I'm on now. So, and that included doing travel PT, starting to produce more content, which I was doing over the course of my career. And it was, initially just so I could learn better. But then I started taking it a bit more seriously. Fell in love with making video, among other things. And then Mike Lee, who's a chiro out of Seattle, he's like, hey, I want to learn what you're doing. Can you make a seminar? And, I'm chilling in rural Arizona. I'm in Page. I don't know if you've been to Page, Adam, but it's about 4.5 hours from you, and it's beautiful. It's up north. And so I'm like, okay. So I made a seminar, and it's continued to evolve ever since. But I think what drives me the most with that is having taken a lot of continuing education. I think that and having excellent mentors like Bill has put me to where I am today. The barrier to entry can be really high to do things at a high level. And so I want to see if I can make that lower because I think there's a lot of good stuff that we've all spent time learning that is hard to access, but there's a lot of people that need help. And so if I can help people get on that path faster, smoother, and be effective at the things that we do quicker, then that's a net positive for everyone involved. And so that's constantly been my process with the seminar. And it really took stride when I moved to Vegas because I was working at Elevate Sports Performance and Healthcare. So that was when I went into private practice in the cash pay setting. And now I'm at the point where I'm doing that on my own, as well as working with clients remotely, whether it's training, whether it's mentorship, whether it's doing movement sessions and managing other people underneath me who also do that. And so it's been cool to have a shift in variety in what I do, but that's how I got to where I am today. And I'm hoping we can keep the trajectory moving forward and making a massive impact.
I have to call out that the content you did early on, and I don't know if you've done any new ones, but one of the best things that you did for me growing, learning and trying to digest new information were your continuing education course reviews on your website. You would take a course and then you would go in and give this 10,000-foot view of what the course was, but like just enough information that, okay, cool. Like if I want to go take this course, I can learn more. If not, I think I know enough to be dangerous. And I literally just sent someone one of your course reviews. I forget which one it was. I was like, Zach still has that on his website. So I just had to call out like that. Those were brilliant that you had contributed, and I found them incredibly useful.
Well, thank you. Yeah, that was how it all got started. Like I did that I did a residency right out of PT school, but then it was that year after. And it was funny. I went to, did you ever go to one of the Midwest Performance Summits that Bill and Mike hosted at iFast or their conference?
I made it out to half of one year.
Half of one. Nice.
I was able to make, I think, to the second day of one of the ones before. It might have been the
Yeah.
last one before they stopped doing it.
Yeah. So I think I went to one right after. I think I might have been in residency still. I can't remember. It was either that or my first year out. And I met like a lot of the people there, like Eric Otter, our mutual friend. Or I think I met Ron Karate there. I think Connor Ryan was there. And I meet these guys and they're just like brilliant. And I'm like, oh my God, I know nothing. And it's like, I can't have that, because if they're doing this at this level, I need to be able to do that so I can help my people. And so that's when I went on a tear Con Edwise. And it's like that for me, the best way to learn is to apply, and teaching is one of the best forms of application. I forget where I read this, but like in terms of the amount of retention that you can take from something, teaching is by far the highest. And so me writing the course reviews is my form of that. And if it helped people along the way learn better, then that was just an added plus. So I'm glad it also helped you, and hopefully it helped the person you sent it to.
You mentioned a few names that are some mutual friends of ours, and it reminds me of a time that we all used to go to continuing education course on the weekend and just bro out, right? And the pandemic hit, and then the boom in digital space happened, and everyone taking online courses but never really finishing the online courses. And then a lot of, like you alluded to, we're both doing mentorship programs now, so that's a space for people to really dive in, like on an individual level. All right, so Ian, you're running your seminar, so really just curious on your perspective on like what is the state of the union of continuing education and the people to go learn more about what they do.
Well, from what I've taken recently, because I still do take Con Ed, it's a lot, at least in the physical therapy space, it's a lot of tool accumulation. And I think in other spaces, although like when you go to the things that I'm about to talk about, a lot of times they don't offer CEUs. So you don't, you really only see the go-getters who want to learn at those sort of things. A lot of it is people assimilating a lot of the things that they've learned or that they've come across into a different repackaging, which I think has its perks for sure, because I think everyone's going to have their own unique lens, and some voices are going to resonate better with people than others, and I think that's the beauty of education. But I think with what I offer, there's sorely missing something within like the offering CEU space that, especially in PT, that looks at movement. Like it's so weird to attend a movement course for physical therapists. It's actually kind of hard to find stuff. I mean, which is just, we're supposed to be the movement experts, but every course that I see offered is either manual therapy or it's, dry needling, or I don't know. I mean, you were talking about diagnostic ultrasound. It's like we're doing all these things, but there's never movement. And so I think with what I'm trying to offer, at least to physical therapists, this is that movement piece that I think we all need, because at the end of the day, if we're going to be movement experts, we have to get people moving. And so, yeah, it's very unique in that sense. But on the training side, it seems to be mostly accumulation of a lot of knowledge and then packaged this way. And otherwise I don't know what else other people are taking or offering, unless it's, tool accumulation, this style of training or that style of training, or using this modality, or I don't know, Indian clubs. Not that I got no beef with Indian clubs, but it's stuff like that.
No, there's definitely no shortage of of coursework or education opportunities in both spaces. The training, the PT Cairo space, right? Like you alluded to, a lot of tools in the toolbox, but very few systems and processes that can really tie it all together. And I share the same sentiment as a lot of things are repackaging. I can say like, hey, like there's things that I take in bits and pieces from stuff I've learned and package it in a way that fits different contexts and team sports, whatever it may be, performance therapy, right? It's very originality is hard to come by nowadays. And so I believe there's a lot of continuity within a lot of different courses. And it's just a matter of peeling back the marketing and the language to really understand what the principles are behind it. So with that, would love to jump into some of the principles and the thought process within the movement, within the matrix that is what your seminar is all about. Because I just love talking about movement as much as you do. I think as anyone that's into sports performance, sports rehab, or even just the layperson, which you do a really good job of breaking complex ideas into simple solutions, can learn from. So we would really love to open the conversation of this next chapter, as you may, to like a broad stroke. Hey, what is your approach to movement within the Matrix seminar?
It's two things. It's and I'll say this without getting too like into physics or biomechanics too nerdy, but you need to figure out what the person's goal is and get them enough motion at their joints so they can achieve that goal, and then build the fitness qualities necessary to achieve that goal while minimizing trade-offs. And ideally doing that in a manner that's simple and easy for the person to execute on a consistent basis. And that's what I teach.
Let's double click on a few terms there. Let's double click on physics. I've regained I've regained an appreciation for physics as I've grown and learned more about movement and fitness and training, because you realize that underpins a lot of the con ed that we go and learn about, or a lot of strategies you may try. But at the end of the day, you're talking about force, velocity, acceleration, mass. So really curious, within your mental model of the matrix, where does physics play a role in movement?
I think is everything. It's the things that you mentioned. I think, and I have to give a lot of kudos to Bill on this, but appreciating fluid dynamics and its relationship to movement has been very informative for me. Not just that, but also just shapes, meaning we're all built differently. We all have different constraints because of those builds. And we need to do whatever it is we need to do to address those dynamics. And to your point, based on different builds, there's certain ways that will be better for people to apply force than others, and vice versa. And I think having that understanding of the physics behind it has been very informative. And I think if you recognize that these dynamics apply not just at the individual parts of a person, but the whole, it makes it easier to make a more comprehensive approach to improving movement. Instead of addressing, having 10 exercises for 10 different joints, a lot of times you can create strategies based on those principles that have a broad systemic effect on one's movement. And that can save time, that can address multiple areas at once. And, based on what I've seen with my patients and clients, and also the people who have attended my seminar or who work for me, we've seen the same. So I think it's important to understand that. And I don't think we have everything figured out. I think in that sense, I think there's still a lot of, the limitation with some of the first principles thinking is with the things that we do. We don't utilize the scientific method as much to see what actually is meaningful versus not. We can get lost in the theory, but at the same time too, I think we have to appreciate that's probably the fundamental unit of movement and the things that we do with patients and clients.
You mentioned the scientific method, and it's a phrase you might hear people say in a space is test, retest, right? This idea of apply intervention, test, test, intervention, retest, right? That's the scientific method. You said, we may get lost away from that. Why do you think that is, and how do we kind of center ourselves back to that? Because it is important, right?
I think that when you're taking these when you're running these N of 1 experiments, the hardest thing about that is you don't have anyone to check your biases. And we all have biases. We all have confirmation bias. A lot of times we all see what we want to see. And I think sometimes that can lead people down paths that maybe aren't wholly accurate with reality. And that's always the hardest thing. Was it Carl Sagan who said about the fooling? Rule number one is to not fool yourself, and you're the easiest person to fool. And maybe it wasn't Sagan. I can't remember who it was, but I think that quote's quite relevant, which is why I think taking what we're doing at a higher level with research and literature is important, because it does help check those biases to see what actually matters versus not. And while I might not be able to do that with some of the things that I teach, because it's just not a skill that I have, running that by with people who I respect and seeing what they would do in this circumstance, or what they see if I have a patient who's maybe doing something and I did this, I think is useful. And maybe that's the next best thing in lieu of being unable to research a certain thing.
I'm going to throw a phrase out there that just came to mind that I've heard in the past, right? Human research is trying to homogenize a heterogeneous population. And with the N=1 and checking your biases, how you and I can sit here and say, hey, the human body is very complex. You talk about task, intention, environment, constraints, shapes. We understand that. And we still have to provide practical solutions. So when you talk about a heterogeneous, population, that being humans, yet trying to homogenize and create these systems and processes to make actionable decisions, how do you do that in an effective manner without undermining the complexity of what we're really talking about here?
Yeah, that's a good question. I think you have to recognize that there are individual differences, but we can probably bucket people into certain categories. For example, if you put, I don't know, NFL linemen and ballerinas in the same study, and you tried to measure certain ranges of motion or certain anything, tissue properties, and then you applied an intervention, you're probably going to get widely different outcomes. And so I think maybe the thing that needs to be done is figuring out how to best stratify people into buckets of, instead of homogenous, what's like, this group seems to be like this, and this, and they have these common traits. And then this group seems to be this, and this, and they have those common traits. And then maybe you select and apply your interventions based on that. But I think that would also be very challenging just as a researcher, because you have to think on another level of that. And then there's also probably the necessary, you have to do research on what are those characteristics that make people similar, and what's actually relevant in that. And that's, a whole other problem. And that's, I think, what makes it challenging. But it's not saying it's an easy problem to solve, because it's like, at the same time too, we still have to do something like that so we're able to check ourselves. So yeah, I don't know what the answer is to that.
Within your current framework of the seminar and what you teach, you reference buckets, you reference stratifying people into different categories, right? Is that something that's part of the process that helps those that are trying to simplify this complex phenomenon of movement? Is that something, as far as bucketing and stratifying movement, is that something you currently teach?
Yeah. So what I do is I break people up into certain archetypes. So the two things that I think about with that is you have to appreciate structural differences. So, there's a reason I use the NFL lineman and the ballerina as an example.
Can we double click on the structural differences? Because I understand what you mean, but I'm not quite sure everybody else. I think on the surface, right, we could say, okay, yeah, anthropometrics, offensive lineman, 350 pounds, ballerina, maybe 100 pounds soaking wet, right? That on the surface level, I think is easy to understand. But what I think you're referring to is a little bit deeper when you talk about structural differences. So could you double click on that just to provide some more context?
Yeah. So there's a wonderful equation in physics. It's called Poiseuille's law. I'm going to give you the modified version and basically what the takeaway is from that. But the radius of objects, so you take a circle, chop it in half, so that line, and then half of that line, that would be a radius, is inversely proportional to pressure. Pressure, you could think of force production, contraction, what have you. So if I have something that has a big radius, imagine a hose. I take a hose and I turn the water on and water's shooting out. That has a big radius, certain pressure is being generated in that circumstance. I can increase the pressure that water's coming out by putting my thumb over the hose, just like you should do every summer to your friends. You get them. There, I've made the radius smaller. That's increased pressure. That is very relevant when it comes to anthropometrics. Things that have larger radius, whether that's a limb, whether that's a person's rib cage, whether that's their pelvis, all of that influences pressure generation capabilities and contraction capabilities. And so because of that, you get different abilities to produce certain movements depending on not just the position that someone's in, but also the directionality at which they're applying force and more. And so that plays a massive role in what access to movements we have versus not, force production capabilities, et cetera. I think, and again, I'll go back to a person who has done a far better job at categorizing this, Bill. He's done an excellent job of breaking them into two different extreme categories and then recognizing that there's a bunch in the middle. So the person who is the NFL lineman on one extreme, that person has a wider or larger radius within their torso and probably other areas. The person who's a ballerina, much smaller radius. So they have different pressure generation capabilities. That corresponds with different movement potential versus not, as well as what directions they are best at applying force or moving within. And so in the seminar, I discuss elements of that, but I try to keep it much simpler than as complex as it can get. But then you also have to recognize that you can have these predictive models based on those factors, how someone may or may not move, but based on a lot of factors that we don't know. I'm sure genetics plays a role, environment, et cetera. You can have other things layered on top of that make movement complex. And so what I try and do is I try to also bucket people into other strategies or, movement. I hate saying compensations, but compensations that people may present based on the simple thing is range of motion testing. And then based on that and appreciating how the fluid dynamics work within movement, that gives us some ideas in terms of where we might have to drive more range of motion with those people, and what strategies might be best with applying force or building fitness while minimizing trade-offs. And so those would be some of the things that we touch on in the course, and also just what I think about when I'm working with people. You have to appreciate anthropometrics, but you also have to see where the person is at based on a lot of the other factors that I talked about. And ideally, you want to take them where they're at and try to move them in the opposite directions that they can't get into.
I don't want to give away all the secrets of your work, but there's two words, there's two phrases you said frequently so far, and that's fluid dynamics and pressure. And then what first comes to mind is how breath and respiration impact one, if not both of those. So would really be keen to learn from you how you would briefly tie in those three concepts, that being, how are fluid dynamics, pressure, breath work interconnected or not connected?
Well, fluid dynamics, the best way to learn is with a stress ball. So let's talk pressure first. This thing right here is a fluid-based system. All right. You come to the seminar, you get one of these. Although you could also just buy them on Amazon. But if I squeeze part of this stress ball, you can see that the beads move away from where I squeezed, right? And so what does that mean? Wherever I apply pressure, fluid moves away from that pressure application towards where there's space, okay? Because right here, I've reduced space. So that's how we can see fluid is affected by pressure. Now, how does that relate to breathing? Breathing works the exact same way. The air that we breathe is analogous to a fluid. It works similarly, although there's compressibility within air, but we don't have to get too in deep depth with that. But if I apply pressure into something that air goes into, that's going to affect where it moves. And so an easy example of this is when we breathe in, we use negative pressure to pull air into our bodies. So it's kind of like a syringe, right? Or you take a syringe, you stick it in water, and you pull the plunger away, water goes into the tube. We do the same thing when we breathe in. And so right there, you can see the application of pressure and its relationship to respiration, breathing. And I think all three of those things are critical when it comes to movement, because if I have a situation, whether it's within a joint or whether it's within rib cage or whether it's within the abdomen and pelvis, because that stuff within there, the fluids, which would be your guts, also move, you can appreciate that pressure and space influence what movements are or are not available. So if I have the ability to squeeze, apply pressure in one area and expand fluid in one direction, but I can't reverse that, that's going to limit the dynamics of fluids. That could be in the joint capsule, right? Because the joint capsules contain fluid. That could be the air that we move as we move our arms, limbs, or as we breathe. And that could be where the stomach contents have to go. Same thing as we breathe in, breathe out, etc. And so all three of those things are really just the same action. It's just looking at them in terms of different locations and contexts. But it really just comes down to wherever I create pressure, fluid has to move away from that pressure. And if we want to have full dynamics of a fluid-based system, we got to be able to apply pressure in a lot of different areas. We have to be able to move fluids into those areas. And so then it's just a matter of applying that using respiration, which is a way to change shape, as well as, positioning the body in various ways to encourage movement of the fluids.
There's a popular modality I want to call out here that probably influences shape changes, that being Normatec compression boots. If you think about what those do from a lower extremity perspective, right? Normatec compression boots, the popular boots you see athletes or weekend warriors wearing, where it's a gradient from the feet to the hips of just these chambers inflating and deflating to just create pressure. It's like you said, increase pressure, fluid moves away from the pressure. And the goal is that pressure segments all the way proximally to then help move fluid from a recovery perspective. But the other thing I wanted to call out here, and you mentioned it because you've done a great job explaining those three things, but another contextual example that I've seen you talk about previously on your social channels are when you mentioned the guts and the stomach and the pooch belly, right? And the pooch belly, and how if you, from an exercise perspective or from a movement corrective perspective, let's just use those terms, although they may make you cringe a little bit. How can you make someone not seem fat with a pooch belly, or you increase their height by an inch by changing the posture of their spine, how that also impacts a pooch belly? So could you briefly talk about how you, from a context perspective, to tie all this in together? Because it was great. And you've done great work, and I want to make sure people really understand and grasp this. How is the pooch belly an example of the interconnectedness between fluid dynamics and pressure?
So with pooch belly, and just so we all know that, if you ever see someone who is fairly lean and has what appears to be a lower part of the stomach sticking out, a lot of people think it's that last percentage of body fat that they just can't get, even though they might be sub 10 and that still sticks out there. You can look at it as, and maybe that's a possibility in some cases. With some people who reach out to me about this, you still probably got to lean out a little bit. But there's actually a lot of people where that's not the case. And so how does what we just talked about relate to that? Well, it's the same thing that I'd mentioned with the stress ball. It's just now you have to look at the trunk and the stomach as one unit. And so if I have a lot of pressure up top, and so what's up top? Up top would be neck. Up top would be, your rib cage area, among other things. And that creates a lot of pressure downward that pushes the guts lower, and they have to go somewhere. The issue is you have this pelvis that's also pushing up at the same time in certain aspects. And so the guts can't go all the way down, at least I hope not. Otherwise, you've got issues. But so then what's the other alternative? Well, it could be in some individuals that the guts, the fluid tends to sit more forward. And so how can you fix that? You can fix that by reverse engineering that process. If I can create a situation where I'm better able to generate pressure in the area where the guts are sticking out, and most importantly, I can relax or release pressure in the areas that it's higher, namely I can create range of motion changes in the thorax. How do I do that? Reducing muscle tension. That's where breathing is important, because when you breathe, your rib cage literally changes shape. It gets bigger, so you create more space, and that can allow the guts to migrate upward, so that way the diaphragm can better ascend, and that can change the resting position of where your stomach contents are. And the cool thing is, in some individuals, this can change pretty quickly if you pick the right move, if they can execute to a high degree, and they don't have significant pressure, not just in the trunk region, but also in the neck cranium, among other things, that is causing that downward force. And so we literally took this concept of squeezing a stress ball in some place, and then we applied it in the context of movement. And that's, I think, what the beauty is of the approach is you're literally doing the same thing over and over and over again in various contexts.
And then you can tie that into, you talk about the lymphatic system and muscle pumping, trying to move fluid, right? Same thing, creating height to pressure gradient there as well. It's another physiological application of that as well. So thank you for entertaining my curiosity of tying those principles together, which we have to go back to the original question of, which was, hey, how are you stratifying and bucketing movement within your framework? So I appreciate the little detour, but let's bring it back to, the navigation here and jump in a little bit more into how you're bucketing movement.
Sure. Well, I was able to do that because of your great questions. So basically what I do in terms of bucketing movement, or at least limitations in movement, is I take this concept and look at how it applies in different areas of pelvis, thorax. That's specifically what I talk about mostly in my course. And so imagine I have certain parts of the pelvis where there's a lot of pressure that pushes the fluids within there, which would be the goods or the viscera. You have the same thing apply into the low back region. You have the same thing in the thorax region. And basically what it is there's certain portions of those cavities where pressure is too great that affects what movements can and cannot be produced. And then it's a matter of just creating space in those areas and then getting people to apply force in a manner so that they're able to maintain the ability to keep that space when the intensity of activity increases. So, in the context of things that we have done is that could be sport. That could be doing so with just everyday tasks. And that's basically what the movement model boils down to. So I'll give you an example of that. So let's say I have a situation where I always do this analogy in my course. Let's talk pelvis. Suppose you went to Chipotle and you had triple order beans and things are happening. And so what do? You tighten your glutes to make sure you don't release the demon. That is an example of increasing a lot of pressure locally in a given area. And that will limit your ability to move in certain directions if that was you just at all times or as you're battling these beans. And so what kind of things would you not be able to do? Well, you probably won't be able to touch your toes because in order to touch your toes, that area has to relax, has to expand. You have to be able to move the fluids in that region so you can do that. You might not be able to internally rotate your legs because if you squeeze your cheeks really hard, your legs move outward into external rotation. And so you can see how just increased pressure in one specific area affects a wide variety of movements. And so then it's a matter of what can I do to open up space in that area to capture those motions and get them back. And so if squeezing the cheeks and pushing the hips forward creates those limitations, if I take someone and I can create space to go in the opposite direction through various means, that's a way of regaining your motion. And so what might that look like? Could be hinging backwards, could be driving internal rotation, but maybe you got to do so in a position that's easy for the person to do that. Could be not eating Chipotle. But there's a wide variety of ways to do that. But that's basically like how I teach the concepts to people. And the cool thing is you don't need a magical exercise to do it. You just need to understand how can I put stuff in that area to create the desired movement adaptation. And then you can come up with a million things. That's why I have a bazillion exercises on my channel. Now there might be some that I use for like 2 people and then that was it, but it's just me applying those same principles and that thought process ad nauseum when it comes to affecting someone's movement in a favorable light.
Let me ask this question because I get this question quite a bit. Talking in the realm of athletics and performance, right? I appreciate the desire to improve movement if there's symptoms and pain. Oftentimes in athletics, that may not be the case, yet there may be goals to improve movement for other reasons, albeit if they're desirable or undesirable. Talking in the space of athletics and high performance and talking about these pressures and shapes, sometimes these pressures and shapes and archetypes are what make them exactly who they are. It's their gift of being athletic and being a high performer. And so the question I have for you, how do you decide if it's valuable to pursue some of these interventions to impact movement if and when pain and symptoms aren't present yet, they don't align with your model of movement?
I think in that case, you have to look at, pain symptoms is one undesirable output when it comes to movement, but there could be a lot of other undesirable movements that are related more to performance. Maybe a certain person can't access a position that if they had the ability to do that and their structure had the capability of doing that, that might take their performance from one area to the next. Or maybe there's certain instances where a lack of a given motion increases their risk factor of having condition Y and Z. For example, there's some literature showing a loss of hip internal rotation increases your risk factor of developing an ACL tear, among other things. There's a couple studies also that indicate potential increase in low back pain in terms of risk for that. So I think you just have to look at what are all the possible rate limiting steps that are limiting you from getting the outcome that you want. And then it's a matter of systematically addressing each of those to ideally improve that desired output. And so in that case, I think it can still be important to address the movement component. Is it the only piece that could potentially be a limiter? No. Obviously you can have changes in tissue adaptation or an inability to produce certain adaptations within the tissues, I should say, among other reasons for that. But I don't think you can ignore the movement piece as well. And I think, I can only speak to some of the sports that I've worked in, basketball, namely one. Golf is another one that I've spent some time working, improving one's ability to access certain positions that they might not be able to, unless you are also at the same time not doing the thing that they do that makes them great, namely playing their sport. I haven't seen many negative side effects from that. And I think even though we can do a lot of powerful things with people, I also think we might overestimate the way we can change some of these individuals or have an effect. Because I think, that if they've made it to a high level in sports, that's years and years and years of adaptations. And to me, it's hard to believe if you choose 1 to 2 moves that could open up some space, maybe allow them to move a little bit more freely, that it's going to wreck them. But if it's done in lieu of doing the thing that they need to do at the end of the day, then I think that's the one time where that does happen, where you could. So, but there's a great book. Otter recommended this to me, Eric Otter, called The Goal. Have you read it, Adam?
I have not.
Oh man, it's probably one of the best books that I've read in the last 5 years. But it's actually a business book, and in it, the guy, can't never pronounce his name, but he talks about the theory of constraints, and he does so through a wonderful story about a factory. And basically, this factory is going to go under if they don't address the reasons why they're not outputting as much stuff as they need and making money, basically. And so what the guy does is he systematically goes through and figures out where the bottlenecks are in the ability of this factory to run. And I think you got to do the same thing when it comes to any type of movement output. And in some individuals, the movement component, despite not having any pain, discomfort, could be the rate limiting step. But you don't know that unless you assess it and you weigh it against other potential variables that lead to that outcome. And then it's just like we talked about before with test, retest. You do some stuff, see if it changes. Does that change the thing that you're trying to change? If it does, awesome, you made the right call. If it doesn't, then you got to move on. But I don't think it's something we ought to ignore, at least for a majority of people.
You alluded to some research, and it didn't slip past me that the loss of hip rotation, internal rotation, produced low back pain, so up the chain, and potential risk for ACL down the chain. If you think about from a knee valgus perspective in the ACL and then low back pain, okay, why is that happening? So I would love elaborate on that, because I believe you have a good perspective on a theory as to why that may be. Like, why would a lack of IR in a hip, internal rotation at a hip, produce risks in 2 joints that potentially are compensating for that IR? Like, why is that?
Rotation of any kind has to be produced in order for us to move. And when I'm talking about it in this context, you have to delineate it 2 different ways. So there's rotation in the traditional sense, internal, external. Can a hip move a certain way? Can a shoulder move a certain way? You also have to look at it in the context of movement. Internal rotation is the ability to apply pressure in a given area. So if I use my stress ball analogy, me squeezing could be looked at as an analog to internal rotation. External rotation would be the expansion of space in a given area. So when I squeeze this ball, where the beads are going, that area is externally rotating. So you have to produce these rotations to do all of movement. Every movement has some rotational component to it. There's a really good study by, what's her name? I met her, Paula Ludwig, motion of the shoulder complex multiplanar humeral elevation something. I tell you, in this study, what they did is they basically drilled holes into the humerus and some of the other bones. I'm like, that must have been a sick Applebee's gift card. And they measured different movements that happen in various planes. And when you raise your arm overhead, there's external rotation that happens in the shoulder, even though it's a sagittal thing. When you abduct your arm, there's external rotation that happens as you raise your arm overhead. So there's rotational elements with all movements. And so if we circle back to inability to produce that in certain parts of the body's still got to figure out a way to do that somewhere. And so in the case of a hip, if a hip can internally rotate and a hip has to internally rotate in a variety of things, it could be that motion gets produced more so at a place like a knee. And so how does knee internal rotation happen? Well, you have a valgus action. And if I have valgus in just the right way, where I have a lot of downward force through the inner part of the knee, but then the foot's planted in a certain way and it rotates in the opposite direction, you tear an ACL. You could look at the same thing with the pelvis, or not the pelvis, the lower back. If I can't produce internal rotation at the hip, it could be that there's some movement-related changes that have happened in the low back that lead to the loss of that specific action. And then maybe you have either a localized pressure or internal rotation somewhere in the back, and that can contribute to the pain experience. Or you have a situation where an area of the body gets expanded too localized, and that could also be an issue, like a disc bulge as an example. And so what we're trying to do in the context of movement, if one of the goals is to maximize range of motion so a person can do what they need to do, that would be an aspect of that, because if we have more range of motion across a broader number of joints, well, then that person can distribute those rotations, distribute load over a bigger area. And then you don't have these localized problems as much, unless that person pushes their body or puts their body in a situation where they can't manage those pressures. They can't produce those rotations across a broad area, whether that could be sitting for 16 hours on a plane, or they push themselves to their physiological limit and they have to reduce space in order to perform the action. And so kind of a long-winded answer, but I think that's how you could see a loss of emotion in one area having to be distributed in other areas.
This is perfect. I appreciate you explaining it in such a eloquent way. So thank you, because I understood there was a deeper layer to that you could communicate beyond just rattling off some research. So thank you again for sharing that. And I want to pivot here and kind of just talk theoretical, or maybe just space that you and I aren't technically familiar with, but we just kind of like where we are in modern society when we talk about technology, data, the influx of artificial intelligence. We were talking about large language models earlier. When it comes to the evaluation of movement, what are you hopeful for when we see things like the evolution of ChatGPT and what we're able to see there, and evolution of AI with a lot of different apps and technology? Like, what are you hopeful for that AI and modern technology can improve our capabilities to assess movement?
I think there's a few things, and you had mentioned this earlier when we were chatting before we did this, but using it to pick out certain things that maybe human error doesn't allow us to always catch. We were talking about the ultrasound stuff and how that might allow us to better pick out the anatomy. Maybe there's certain things that AI can pick up that maybe we don't see with the naked eye right away from a movement context if we look externally. But it's funny, I just thought of this now. Maybe AI is the way that we can help control our biases, because we have something that can just process so much more data points than we can. And if we feed it the right information, maybe that's the way that we check our biases. In ChatGPT, it'll tell us in a nice way that we're wrong, as it tends to do now. So I think those are the things I'm most excited about. Um, and, my hope is if we learn how to wield this technology well, it's going to allow us to be much more efficient and effective at our jobs. Because what if you could create an environment where you can expedite the number of reps that you're doing by taking multiple very good providers, having them spit data in terms of what works and what doesn't, given a certain amount of things, and then it isolates the variables that are necessary to achieve a certain goal. Like, to me, that could be so powerful. It's just a matter of making sure we give it good data sets and actually following through on using it. But I will say I'm by far not an expert in AI, but just seeing what it can do now with the bit that I've used it in my business, and not only that, but also with some of the rehab modalities that I do, I'm very hopeful that it's going to take us to another level.
You mentioned it. I mean, the important thing about everything you said is the data that you put into the system, right? You got to teach it. It has to understand, it has to learn. The challenge that I foresee, and I'm curious if you see this as well, is when you talk about continuity of assessments and interpretations, and then when you try to teach these large language models when you talk about biases and egos, or you talk about biases and theories and perspectives of how to go about what movement is, right? Not many people consider fluid and pressure, and every motion has rotation to it. There is still some traditional thinking of straight plane motions. So the pitfall that I see is not having a consistent language to be able to put into these systems, because of there is some element to creativity and autonomy when you have your own bias and have your own theory and perspective. So the question I'm trying to ask here is, how do we decide what is the right movement or what is the right assessment to then teach these models to help make us ultimately better at what we do?
Yeah, man, that's a great question. And I don't know if I have a good answer, because essentially what you have to do is you have to pit the models against one another. And maybe AI has the ability to suss that out, because I'm certain that everyone who practices a certain way at a high level gets good results. And at the same time, too, also has people that they fail with. And so I think there's still a lot that we don't know. And perhaps AI can help suss that out in terms of what is most relevant in that circumstance. But it's a great question, man. I don't know if I have an answer. I mean, I always think one thing with some of the stuff that we do is, like, what bothers me is I don't know what the alternative hypothesis is aside from the null, like, meaning none of this matters. And maybe it doesn't, but it's hard for me to see what could be another way of looking at things that is possibly better. And again, maybe this is just my bias going into it, but it's like when I, over my career, have seen people who have practiced in other ways, it seems like the things that we find meaningful, the stuff that I do or that people who I respect do, seems to get to that endpoint much faster than others. But I have to imagine that there's people who aren't thinking in this way that get very good results, and maybe we just don't know about. But perhaps AI can help us suss that out a bit more.
The other example that comes to mind is not only within this country, but you think like the international space, right? You think about like Eastern medicine, how they view, how they view the human body. You think about down in Australia, Australian trained physios. You think about UK trained physios. You think about the countries in the Mediterranean. These countries all have cultural influences on how they go about, let's just call this blanket term of physiotherapy, which is this, industry that is trying to improve movement, help people get out of pain and move better. All right. And so that's the other exciting part that could potentially be, is like, man, can you put all of these cultural influences together into this big melting pot and see, hey, like, what can we take from all of it to get this really unique perspective that I'm sure there's things I've never even heard about that people in East Asia are talking about as if it's first principles, and then same thing in other countries, right? It would just be really exciting to learn if that would be a way also to kind of bring more ideas together to then get a larger filtering system and maybe a more robust appreciation for the things that we do when it comes to managing, interpreting movement.
Yeah, that's a good idea that I don't think I would have considered. But when you had talked about that, it reminded me of a couple stories. So I worked in Page, Arizona, which is right on the Navajo border, and I worked with this woman who she was dealing with some sort of calf or tibialis anterior or something. It was something in the leg, and she came to me one day and said, "My leg's doing a lot better." And I had said, "That's interesting. So, how are things going, or what'd you do?" And she ended up working with a medicine man, and he pulled like some sort of, I don't know, evil something or other out of the leg, and that's what led to a substantial improvement in her symptoms. And there's probably definitely something cultural there, because that specific population is very much into that. Or like I teach in China a lot, and last time I was there, I got sick. Like, I mean, my voice just sounded terrible. And some of the crap that they gave me, it's not crap, but I don't know, I can't read it, so I don't know what it was. But it got dark in here. Like, they gave me this thick, syrupy something or other that was Chinese medicine, and they're like, this is what you got to have in order to get better. And it worked. So I think that's something that we probably don't appreciate enough of. And it could be that maybe you have to find other variables beyond just the movement stuff that we look at, that maybe based on this factor, that factor, this cultural piece, these anthropometrics, this social situation, that all of those variables are what lead to this intervention, and that intervention being the best for that person in this circumstance. I anticipate AI could probably figure that out. Maybe not now, but 5 years from now, for sure.
I think we might surprise ourselves. It might happen sooner.
Yeah, videos first. That's the big thing.
I'm also just really curious what was in this magic syrup, and if there's a way to bottle up and bring it back to the States, because I have an infant that is a toddler now that is going to be in daycare, bringing home every germ possible. So I will take anything to keep this immune system thriving over here.
I still got these, like, oddly enough, it's not the syrup, but I do have, like, what is this? Ginsangi Hupian? They gave me like 5 things, but I could give you some of that, Adam, if you want, man. That's the good stuff.
I will gladly take that in the U.S. Postal system. Thank you very much.
Yeah.
Hey, Zach, this was fantastic. I have a few things I just want to leave our community with, because we talked about a lot of things. We took a deep dive, some things, maybe some new concepts people aren't familiar with, maybe some concepts that people are familiar with. You did a fantastic job tying everything together. It's one of your greatest assets, man, when it comes to teaching, be able to take these complex ideas and make them so simple. I certainly have a new appreciation, or a better understanding of the fluid dynamics and pressure just by the way you taught it, man. So I just want to acknowledge that you are very good at that. And so one other thing that you're very good at with is just providing simple solutions and good advice for people. And so I'd really just love to hear, like, people are always talking about, hey, I want to move better. I want my posture to be better. Like, I want to just feel better, like chasing this posture, this movement, whatever it may be. What advice do you have for people who want to improve their posture or movement?
I think the important thing is to have some sort of goal in mind that is measurable, because good movement, good posture is individual, because people are built differently. That person's perfect posture, and I'm definitely scare quoting the heck out of that, is going to be unique to them. And so what I think a better goal, I mean, I think intuitively we think about this in other contexts, but we don't always with posture. Like, you ever have someone say, like, oh man, I want to look like person X, but they have no resemblance of that person's build whatsoever. And I think you have to apply that to posture as well. It's like, I want to have, like, be chest tall, shoulders back at all times. It's like, no, you want to get yourself into a situation where you have the most amount of movement possible, that you need to do what you want to do, and then just improve your fitness levels to the same coin. And so I think having a movement goal that is outside of some of the basic constituents that we work on with people, whether that's range of motion, whether that's being in the gym, I think that's probably the biggest thing that the biggest advice that I can give people. Because I see on the other side, being on the internet, being that I do teach this stuff, I see the negative side of that, where the person's end goal becomes chasing something that they can never really attain, or it becomes their sole purpose. And I think that has a ton of negative consequences because of it. We want to have something that's beyond that. And so I think using movement as a tool to attain something outside of them or that's bigger than them is really the best way to use this stuff, while minimizing the potential negative effects that can come with things like posture and all that. I mean, and I said this on a video earlier, and I think it bears fruit to say it again. Like, the reason why I even talk about this stuff is because I want to meet people where they're at, because I know that they care about this. But my hope is, over the long haul, that I can get them to go to that side of the equation. Like, if I can take someone who's concerned mostly about fixing their pooch belly, and eventually I can encourage them to get to the point where they're playing pickleball with their friends once a week, and like that's what they love doing, like then I've done my job and I've won. And they're able to do it pain-free and at a level that they want to do. And so but if you want to save yourself some steps, see if you can get to that last point.
And then along those way, I would imagine you're going to have some ups and downs with it. So, some of the clients you see virtually that are trying to achieve that end goal, right? Achieve that posture, achieve that pickleball opportunity. What are the ways you help them find small wins, and like, how do you define the small win for people?
Yeah, I am meticulous about tracking, or at least asking, what are some things that they notice are affected by X, Y, and Z that are outside of a static thing. And I will always ask about those things, because if someone can sit longer, or if someone can, do a certain thing now that they couldn't before, that's a big win. Another thing I do is I take a lot of pictures. I think a lot of people get stuck in feeling a certain way when they do inevitably hit that low, and they think nothing's better, I can't do anything, this isn't working, blah, 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 blah. But then I show them a picture of where they were 3 months ago. I think that's a good litmus test, or a good way of letting them know that actually you have made progress. So finding a multitude of ways to measure progress. Those are the ways that I help people, to help them feel like, or that they can attain small wins. And then the other thing that I do is I talk a lot about where they're going. So the things that we discussed before, that's looking at the past. I also think about where in the future, the thing that they're working on right now is taking them. So I had someone earlier today who I was seeing. She's got a history of dislocations in a shoulder. She's doing way better with that. Has not had any in like 6 months, which is amazing. But she's still at a stage where, on the rehab side of things, we're working on lower intensity things, because with her trainer, he takes care of the higher intensity things. And so she said, today, hey, Zach, I'm not going to be able to see you for a bit just because of financial stuff, what have you. Where are we going with some of this stuff? And I gave her 2 moves, and I said, so what you're doing right now, this is a high-level side plank 4 months from now. This other move right here, that turns into a back bridge, maybe never, but that's where I want you to think about where you're going. And so you kind of give someone a beacon of some sort of movement goal that they're ideally going to hit, or at least aim for, over the course of their time that they're working on some of these things, or maybe in that case, lifespan. I think if you can make things to give people a goal to aim for, and then show them the progressions along the way, that can help people stay focused and hopefully do the 2 things that I wanted them to do at the end of the day, which is have more motion than what they got and get the fitness qualities needed so they can do the things they want to do. And I think that's it, man.
I couldn't agree more on shedding some light onto what the end goal is, because in our heads, we tend to know what that is, but sometimes you just got to give a little nugget and a few breadcrumbs to encourage the motivation. Oh, I see where this is going. It's important to help help illustrate the journey that some of these paths of rehab or improving movement may be. So, man, you nailed it. This is exactly what I was hoping for. I learned a crap ton from you, man, as always. I appreciate the simplicity yet the complexity that you share information. So whenever you're in Arizona, please let me know, and I will gladly reconnect with you in person and not in two.
Let's do it, man. We got to go to Los Dos Molinas. I don't know if you've been there. That was my jam when I lived there.
But you know what? Take a rain check on that. I've not been there, so add it to the list.
Man, yeah. Not a sponsor. Very good New Mexican food.
Understood. Well, hey, man,
Yeah.
final note is you are very active on social. You run your own continuing education seminar. How can people come learn from you and just get in contact with you if they need some help with the way they move?
Yeah, the base hub is my website, Zac, Z-A-C, Cupples, CUPPLES.com. There I got lots of blogs, but links to YouTube and Instagram and all that stuff is on that. And then, yeah, if you want to attend the seminar, there's a link for that there. Or if you want to work with myself or any of my coaches, help yourself move better, help yourself attain some of your fitness goals that you may have, we're here to help. Hope to see you there.
Nice job, dude.
So your questions, man. You have some good ones.
Thank you, man. I appreciate it.
Was it okay? Do you have any feedback for me? Anything I could have done better? Or?
No, man. Like I said at the end, like I genuinely meant that. That wasn't just, propaganda. Like you were very good at taking a complex idea like a law and principle from physics and explaining how it is applicable in this industry. And then being familiar with some of your work helps me bring back some conversations around context, because context matters, man. And that's always what helps people really grasp the concept. So I would say, if there's any of that content, any of those analogies that you're not using in your course, start using them. It sounds like you are already, but like the butt clenching makes total sense. The stress ball, that was brilliant. I wish I had Bill teach me that the first time he tried to talk to me about pressure gradients.
Way better than toothpaste, in my opinion.
Oh yeah, way better, way better. Yeah. And to your, like, when you start talking about that relative to interarticular fluid, you start talking about that relative to pooch belly. Like that's probably the easiest one I think people can rationalize with. It really starts to add up. So no feedback, man, is keep on the path you're going, keep diving deeper, keep making, iterations of what you're doing. But I really don't have anything constructive in the sense that, hey man, like really don't know what the heck you were talking about there. I literally, as soon as you said that study about the IR, I was like, no shit, like we need research to tell us that. But again, that was sometimes
but we do,
Yeah, I know you do. No, for sure.
Mostly just get people to shut up on Twitter.
Yeah, no, 1,000%, man.
You're doing pretty damn good with this. No, great questions. I just wanted to give you some feedback. Like you do a great job of letting me talk. Because sometimes there's podcasters that interrupt you. That's not you. And I think you did a good job of hitting points, but then also circling back. So you got a good working memory of stuff as you're doing that, and that's not easy. So nice job, seriously.
So thank you. If you ever do get into recorded conversations, there was a book that I read written by like a guy that's worked at like all the big time production companies, and it basically it was like a master class on podcasting, and one of his chapters was like he's like, the hardest thing when I first started this was switching from guest to host is two totally different dynamics. And so to your point, one of the take home points that I remember from his book was your job is to talk as little as possible during an interview. Your job is to position a question so that way the person just runs with it. And then if there's a pause, your job is to either reconnect an idea to further elaborate, or just ask a simple question to just like give them the nod to like, it's okay to keep talking.
Yeah. Well, you have a great start at this, man. So nicely done. Are you are you using this predominantly to try to get leads, or are you thinking of like making this the thing?
No. So backstory, the podcast started as just a way to dip my toe into content creation, one, but it also served as a means for me to just have a hobby when I was traveling in the NBA. I used to do everything in person, and I had a mobile setup that I would do with people when I traveled to NBA cities. It was just kind of fun, on game days in
Yeah, that's
between
sick.
game days in between shoot around in the game. Like you got 3 hours to kill. Cool. You meet up and grab a coffee with everybody. Why not shoot the shit and do a podcast instead? And
Yeah.
then now it's turned into doing it virtually to reconnect with people. I'm using it as more of a way to just stay connected with people, social credibility. I also am within my performance therapy mentorship, just thinking of, okay, these are the topics we're talking about. Like, who are some people I can bring on the podcast that maybe complement kind of like where my head's at lately as I'm building out content within the performance therapy mentorship. Like I just spent the last 3 weeks building everything from movement and assessment, which is why I was like, I want to talk to Zac and just learn more and see where I need to refine my own process and things like that. So podcast market's saturated. It's hard to generate profit off it until you start getting high viewership and you're competing with the likes of people that have endless budgets that, I mean, really it's the video casting now, truthfully. Like that's the snippets that end up getting more traction than the actual podcast. So
yeah,
we'll
it's
see where it
crazy.
goes.
Like the short form and all that with this stuff is, yeah.
So yeah, I don't really have an end goal other than I told myself I'm going to get to 50 episodes. This was 36. I'm going to get to 50 just to say I did it. And then we'll see where I'm at. Because I'll be honest, it does, as savvy as this software is, there's still a post-production process. You got to choose your short form video. You got to build the social media content for it. So there is, I mean, every episode probably takes, including the recording, probably takes anywhere from 4 to 6 hours of my week. So
I believe that.
It's not incredible. It's not a lot, but it's also, could that be something else that is generating income? We'll see.
Or you farm it out. I mean, it just depends on